Leaving your special needs dog is agonizing. You love them, and the thought of leaving them feels impossible. But a standard kennel can be harmful for an anxious dog, worsening their condition with noise and routine changes. For seniors, this stress causes physical symptoms like loss of appetite or restless pacing. This is about their health, not just their comfort. The wrong choice has serious consequences. We'll give you 5 questions for any Hinsdale boarder that will reveal everything you need to know. First, you must ask, what are your staff's specific qualifications and experience with dogs like mine? Don't accept "we love dogs." You need to hear about formal training or documented experience with their specific condition. Trained staff know a quiet, low-stress area isn't a bonus. It's a medical necessity for senior and anxious pets. For arthritic dogs, are there soft beds and non-slip surfaces to prevent falls? For a blind dog, will they guarantee a predictable space by not moving furniture or bowls? For a deaf dog, does the staff know to use visual cues and approach carefully to avoid startling them? But what about conditions you can't see? How do you know they can handle medical needs? This is question 2. Can I see your medical administration and documentation protocols? This is not an add-on service. It is a core capability. Take diabetes. It requires a strict schedule for food and insulin. A small mistake has huge consequences. A safe protocol isn't a promise to give the shot. It is a system designed to prevent errors. Look for a visible chart on the kennel showing when insulin was given, how much, and who gave it. This prevents overdoses. You verify their competence not by asking if they can do it, but by demanding they show you their system. No system, no stay. Now for the invisible challenges. Question 3. How do you manage pets with neurological or behavioral issues like epilepsy? For an epileptic dog, care is more than a pill. It's proactive stress reduction and monitoring for subtle changes in habits. In their answer, you should be hearing words like monitoring, quiet space, and stress reduction. Remember the anxious dog from the start. This is where you find out if they can truly help them. Ask specifically, how will you replicate my dog's home routine to minimize their anxiety? Their ability to follow your plan is the test. But what if your dog isn't just one thing? The senior dog is often a combination of many needs at once. A senior dog might have arthritis, failing eyesight, and heightened separation anxiety. This leads to question 4. How does your facility provide holistic care for senior pets with overlapping conditions? You're testing if they see your pet as a checklist of issues or a whole being. Their plan should be integrated. And before this talk, get a pre-boarding vet visit. This gives you a clear, documented list of needs for the provider. Let's connect the dots. We talked about staff experience and medical protocols. An amazing staff member is powerless without a flawless medication log. The person and the protocol are one integrated safety system. A non-slip floor for arthritis is good, but useless if the kennel is loud and chaotic, spiking their anxiety. The spaces must work together. This shows the real purpose of these questions. They are not a checklist. They are tools to uncover a facility's entire philosophy of care. To recap: 1. Staff experience. 2. Show me your medical protocols. 3. How do you manage invisible conditions? 4. Your plan for senior needs. And 5. What's your emergency plan? Asking these tough questions isn't being difficult. It's being a responsible advocate for a family member who trusts you completely. For pet owners in Hinsdale, you have excellent options. Use this framework to find the one that truly cares for your pet. Your peace of mind and their well-being are worth the effort. You have the tools. Go find the perfect, safest place for your best friend.